So my name is McCrorie. I am a research fellow at the University of Glasgow. My background is physical activity research, physical activity measurement in children and young people. I'm a lead researcher of the Spaces project, which used activity monitors in a massive big study of Scottish children. So a lot of the work we do is exploring that physical activity data. So we've amassed a lot of evidence over a long period of time at how important physical activity is for our health. For our physical health, for our mental health, for cognitive development and retention as we age, for things like social connection as well, or even just to make sure we age healthily. Now, what I'm super interested in here at the university is how something like the built, the natural and the social environment can perhaps support or can act as a barrier to us being physically active, particularly children and young people. And I want to make sure that regardless of who you are and where you come from, that there are opportunities for you to be active within your environment. So as a further example, children and young people spend a lot of time at home and they spend a lot of time at school. So when I talk about environment, I mean, let's make sure that children's neighbourhoods are supportive of physical activity. Let's make sure school environments are supportive of physical activity. And let's make sure when children move between those two places, they're able to be physically active. So Spaces is uniquely positioned in that we used activity monitors, so a device that children wore for 7 days. Now that allows us to actually extract high-level data about how physically active they were. So across the whole of Scotland, we see roughly 6 to 8% of children aged 10 and 11 who currently meet the recommended daily guidelines of physical activity. So those were set by our chief medical officers and state that children should engage in at least 60 minutes of moderate to vigorous physical activity on average per day. So although we have 6 to 8% on average, only 11% of children and young people in Scotland meet those daily. We see seasonal variation in physical activity where children tend to be more active in the summer than they are in the winter. And we see differences in geography as well, where actually children from rural backgrounds tend to engage in much less sedentary time, so roughly 14 minutes per day, and they engage in roughly the same in light intensity activity compared to urban children. We haven't seen major differences in socioeconomic position or status, so children from more disadvantaged backgrounds tend to be as active as those from more affluent areas, but certainly we see big differences in gender between boys and girls. Boys tend to be much more active than girls. The school environment is also a very important area in which children can be physically active, and we see roughly about 29 minutes per day that children get on average in MVPA, and they get about 3 minutes at the interval time. So I think there's 3 key things that stakeholders are looking to know. Where are children active in their environments? And how does that differ between socioeconomic status or by gender? And I think the third thing that we really want to know is, if we build it, will they actually come? Is it just a case of actually changing our urban environment to make it more affordable to physical activity? Or are there other factors we need to really consider that's beyond that, such as motivation, relationships, and more psychological kind of factors as well? So physical activity is such an important health behaviour. It feeds into a lot of public health priorities, a lot of discussions at a high level with regards to policy and decision making. Now, Spaces evidence can feed itself into things like urban planning. How do we change and actually plan new developments, neighbourhoods, school environments, public parks, play parks, nature? How do we preserve what we already have to make sure children and young people can be physically active in their environments? If we can do that with Spaces, I think we're going to start to see a much improved level of physical activity for children and young people across Scotland. Because Spaces is such a rich data set, we really want all different stakeholders from different sectors to use that evidence to feature in many of their discussions with regards to the decisions they have to make on a day-to-day basis. If we can get all stakeholders round a table to use the data from Spaces, I think we can actually improve the lives of children and young people in Scotland, in particular physical activity levels.